Hello, I'm Dr. Brian Connor. I'm an assistant professor of nursing here in the MUSC College of Nursing, where I've been for 6 years. I've been a nurse for 33 years, with most of my clinical experience in critical care, also in leadership and management positions, and then I've been a faculty member in academia for 9 years now. So it's my pleasure to welcome you to NURSU 428, Practicum in Clinical and Management Decision Making. This is called your capstone course for your RN to BSN program. So what that means is you're about ready to graduate, which I'm sure you're very excited about. But this course is primarily a clinical course with 90 clinical hours, which means that we have to keep track of those hours. You'll have to keep track of the hours that you spend. But one thing that's important to know is, as nurses already, you don't have to spend clinical hours like you did in your undergraduate, in your first degree program, where you had to be taking care of patients and working on nursing units. You're already doing that since you're nurses, so your clinical hours in this course will be spent developing an evidence-based practice quality improvement project proposal. And part of that is also in developing a team that you'll work with, meeting with the team, finding out where the data is, lots of things that we'll discuss. So you will have no problem, I'm sure, spending 90 clinical hours, but we have to record those hours, so we'll talk about how that works a little bit later in another video, just so you're very clear on how you record your hours, and so that we know that you are putting in all the hours that are necessary to get you through this course. So this is an introduction. Hopefully you had the opportunity to view a video I posted in the Research and Evidence-Based Practice course. I also posted another brief video in Mrs. Miller's community course. But just in case there's anybody who didn't see either one or both of those videos, I want to sort of go back over the information, really make this a full introduction to the course. So I have been teaching online in the DNP program for a number of years, and what I have found is I prefer to do videos. Some other faculty do podcasts where you're just listening. They do integrity recordings where you're looking at slides and listening to voice. I kind of like for you to see me, so that's why I like to do the videos. I like to be a little more informal. And I think what's most important is to give you the information that you need to know how to begin developing a project proposal. So there is going to be a ton of resources, lots of information in Moodle, and I'll direct you to where those things are so that you'll be clear on where do I go to find this, what is it that I'm supposed to do first, second, third. We know that that's what's most important to students, is to not have to spend a lot of time trying to figure out what you're supposed to do. So we'll try to be very clear in this course about what's due, when, what are you supposed to be doing each week. And one of the beauties of this course, we are able to have a faculty-student ratio of 1 to 10. So that means we have, I think, 50 or 51 students in the course, and we will have 5 faculty members, including myself. So I'll have a group. I'm the course coordinator, and then I'll have my own group, and then we have 4 other faculty members. Mrs. Miller is one of those, as well as Dr. Jamie Carter, who teaches in our accelerated BSN program, and then we have 2 adjunct faculty members who are highly qualified in quality improvement work. Dr. John Pagantalan, who's a critical care specialist and just received his PhD from MUSC recently, and he has a wealth of knowledge about evidence-based practice and quality improvement projects. And Mr. Carl Kennedy, who is working with Huron Healthcare Consulting. He used to be here at MUSC. He's been entrenched in quality and process improvement for many years in the healthcare arena. So those are the faculty members. We'll all be posting little brief bios about ourselves in Cyber Cafe. We really want you to read those, and then we hope that you will also post brief bios, and I'll have those set up in groups. You will be all separated, divided into groups, and we figure it's probably easiest to I'll put in Cyber Cafe group places for you. So if you're in my group, all students in my group will post in there their brief bios, and we'll sort of do everything pretty much by groups. Doesn't mean you can't communicate with other students from other groups, and if we find something that's really interesting, in one group, and we'll try to share that with everyone. But by and large, we hope the majority of this semester your conversation is with your faculty member who's working with you and the other 9 students or so in your group, and that will be the main contact you have. But really, what this course is all about is it's what we call application. It's hands-on, it's clinical practicum. It's you doing the work with faculty member guiding you as to what you're supposed to do. We only have 13 weeks to get this done, which is a couple of weeks short of what typically the fall and spring semesters are, when they typically are 15 weeks. So it's really important for you to stay on top of everything. Getting behind even in a week or so really makes it harder for you to have to catch up. So just keep that in mind. One of the things that I want you to do first is please, hopefully if you haven't done it yet and you're viewing this video, is to please be sure and look at my welcome announcement, because there's a little more information in there. Look at Cyber Cafe, look at the Word document that says faculty student group assignments, so that you can see what group you're in. Those are the first most important things to get your feet on the ground and have an idea of what you need to be starting to think about doing. Okay, so let me start by what we call begin with the end in mind. The end product for this course, by the end of the course, end of the summer, is that we want you to have a fully developed project proposal, evidence-based practice quality improvement project proposal, which will include a paper that will show you how to write and a poster. The poster is something that hopefully you can carry forward and present this in a way that at some point, hopefully you could even actually get this project implemented, and then the poster will be there already for you. All you'll have to add to the poster if you actually implement the project and evaluate the outcomes is to add the results, the data that you gather post-implementation. But you only have 13 weeks, and that's why we don't have it set up for you to actually implement a full project, starting with getting the pre-intervention data and then implementing some type of intervention to improve patient care in some way, or improve safety, something like that, and then gather post-intervention data. That's typically what quality improvement is, and you don't have enough time to do all of that in 13 weeks. And so our focus is really on helping you develop a project proposal. Our hope is that it's something that is very tangible to your unit, your site, wherever it is that you would like to implement this, and that it's something that you can carry forward even after you graduate with your BSN in August. So this is not necessarily what we consider hypothetical. We hope that it's something that you're really putting into place, that you're really getting a team of people in your area. Hopefully there's some physician involvement or nurse practitioners, there's educators, clinical specialists, other, obviously other nurses on the unit, nurse managers, whoever, maybe respiratory therapy, risk management, infection control, quality improvement people. Somehow you put together a team of people that would be really important in helping you to actually implement this project at a later date. But the real end goal for this course is for you to have a fully developed project proposal. Now, that said, we recognize there may be some of you who are already sort of in the midst of something that's happening in your unit, and maybe you've already done some pre-work on this, and maybe you could actually get a brief sort of small project done. If that's the case, we're not going to stop you and tell you can't do it. That would be wonderful. It's not the major expectation for every student that you're able to actually implement and complete a project. So I want to make that very clear up front, that the most important thing is that you're thinking about fully developing the project proposal using the step-by-step process that I'm going to describe for you in a few minutes, and that we'll describe in some future videos as well. Okay, so some of you may actually already know some of this. You may already be improved in quality improvement. You may be already involved in quality improvement projects in your areas. For instance, I know that the medical university uses a system called Improve. using the letters IMPROVE. They have a whole process for doing quality improvement projects. So some of you may already be familiar with that. Some of you in other hospitals or other areas may be familiar with some other QI models, such as Plan, Do, Check, Act, or Plan, Do, Study, Act, which is a quality improvement, continuous quality improvement model. There's an improvement model from IHI that has been used extensively. So you may be something, may be involved with something like that. So there are many different models. I'm going to describe for you a little bit today in a few minutes the model that we'll be using, which is based on something called Six Sigma. And I'll describe for you a little bit what Six Sigma is and the process that we will use, which uses the letters DMAIC. And I'll describe all that in a few minutes. So that kind of gives you an overview. There's a folder in the All Week section of Moodle that's called the Practicum Toolkit. That is where you'll find virtually everything you need. There are documents, there are a process map, there's a QI roadmap, there's anytime we describe something for you and say you need to have your clinical log, you need to have a team charter, things like that, that's where you'll go to find everything is in that folder titled Practicum Toolkit. So everything that you need will really be in there. Of course, anywhere along the way, if you have questions, you'll ask your individual faculty member just to be sure, where you're supposed to get something and what you're supposed to do with it. But I'll try to be very clear also each week with brief videos trying to explain to you what you're supposed to do, where do you find the resources for what you need, and that sort of thing. So let's just talk a little bit about this idea of developing a quality improvement project proposal. Typically, the first thing I want to do is to just give you a brief way of defining or differentiating quality improvement from research. So in research, and some of you may have been involved in research at some point, or at least you've heard about research projects and studies being done. In research, the researchers are trying to generate new knowledge. They're trying to find a gap in the knowledge about something and then trying to generate new knowledge. And in research, we typically use very rigid methods for how to conduct the research. We try to reduce the potential for researcher bias because in the long run, a researcher may have a hypothesis, and you hear sometimes, well, they're trying to prove a hypothesis. Actually, in research is all about exploration. We're trying to explore and find out what are the connections between a couple of variables, something like that. So research is much more about exploring and trying to generate new knowledge. Quality improvement, on the other hand, in particular the way we are describing it here, is based on evidence. We want to have evidence-based practice quality improvement projects. So that means that you're not trying to generate new knowledge. You're not trying to create something that's never been done before. You want to see what's in the literature, what's the evidence for the best way, what's been shown to be the most effective way to do anything, whether that's something that has something to do with catheter-associated urinary tract infections or with prevention, reduction of falls, any number of ideas or projects that you may have in your mind. Hopefully all of you should have done your literature review and had a PICO question in Dr. Anderson's course, and we'll want you to bring that forward very quickly. Now, if that's not what you're going to do, if you're going to do something else, you will have to work with your faculty member rapidly in the first week or two and to decide what is your new PICO question if it's not the one that you focused on in the research course. And then you'll have to have some literature, do a literature search and find some evidence. You won't have to do the full evidence table that you did in Dr. Anderson's course if you're doing something new, but you will have to provide the evidence that will back up your proposed intervention that will go into your project proposal. So without getting too much more involved in that, because I'm going to try to separate these into different videos so that it doesn't get too long, one video doesn't get too long and get too complex where you start getting lost in what you're supposed to do. So just suffice it to say, we're going to focus on doing evidence-based practice quality improvement, and we're not going to do research. And so we're not going to randomize, and we're not going to have a control group and an intervention group and try to do things like that. We're just typically, when you do your proposal, a quality improvement project proposal consists of what's the clinical issue, what's the background on why this is a problem, and what's the evidence say that is the best thing to do to remedy this problem. And then it's developing the methods that you will use or that you will propose to do this quality improvement project. And that starts with pre-intervention data. You have to have data to show that there's a problem. So for instance, if you're trying to reduce falls, if you have a project where you want to propose reducing falls, you should have a problem with falls, which we know most hospitals still do have problems with falls, but you would want the data on what's the current fall rate per month, per quarter, however that may be. So that's an example of, you want to be able to have maybe infections. So if you're working on central line bloodstream infections, CLABSIs. So if that's the case, then you want the data to start with. What's the pre-intervention data say our infection rates are? And then you propose your new intervention that you believe will reduce the fall rate, will reduce the infection rate, will improve the patient outcome in some way. And you propose that intervention and how it will be done in some detail. You'll try to identify that. And then you will propose to gather the post-intervention data. And the key here is that the pre-intervention data and the post-intervention data should virtually be the same thing, so that you're measuring apples to apples or oranges to oranges and not apples to oranges. So hopefully that makes sense. So every quality improvement project that's ever been done should, and almost always does, it's hard to say always about anything, but should involve a team approach, so that it's very difficult to do something all on your own. You typically need other people. You need buy-in from what we call stakeholders. So stakeholders are anybody that's going to be involved in the process, anybody that may be affected, whether it's the patients, the family members, physicians, providers, nurse practitioners, other staff, respiratory therapists, pharmacy, social work, anybody that may be involved in the clinical issue you're trying to work on. You need to identify those stakeholders, and you need to build a team so that you have a team approach. We want you to be the team leaders of that. That's the whole idea for this practicum, is that you become a team leader and that you lead the project. But it doesn't mean you can't get input from other people. You should get input from others, and you'll have guidance from the faculty, but you are the team leader. So team approach, using a very structured approach, is really vital to having a successful quality improvement project, which would happen eventually, hopefully, but it's also vital to developing a really solid evidence-based practice quality improvement project proposal. It's a lot to say, but all right, so hopefully that gives you a little idea that you begin with a team approach. You're going to identify the team. You're going to begin very quickly to sort of figure out, where's the data? Do I have access to get the data to just see what the current problem is? So those are important factors that your faculty member and your groups will be working with you on. And I just want to describe briefly in this video an overview of Six Sigma, so that you have an understanding of what's the foundation for the methodology that we'll be using, that you'll be using to go through this process. And you'll find this in the QI roadmap. If you make a mental note of that, and I'll be talking about that again in the next video, but the QI roadmap really lays things out very nicely for you. So the QI roadmap, well, first of all, let's tell you briefly about Six Sigma. The whole idea of Six Sigma is, the goal is to reduce variation. Six Sigma is something that has been used in manufacturing for decades. And it really began in the manufacturing world, and in particular in car manufacturing, but all types of manufacturing. The idea in manufacturing, when you're making products, could be widgets, could be potato chips, could be cars, could be any number of things that are being made in a factory, in a manufacturing environment. The whole idea of Six Sigma is trying to reduce variation in the middle of the process, not waiting till the end, which was historically, way back when, the idea was you had quality assurance people. And even in healthcare, we had quality assurance, so that after the fact, we start figuring out how well we did and how many errors we had, how many problems we had. Well, the idea of Six Sigma is to reduce the variation so that at the end, when we're looking back, we have almost no errors, no problems, no variation. So Six Sigma is a term, and I won't go into the details. It's the Sigma level. It goes from 0 to 6, and Six Sigma being the very top. Six Sigma meaning that if you have something that is virtually flawless, almost no problem whatsoever, that you would be at 99.99 something percent of things being correct. So Six Sigma level is the very top. A 0 Sigma level would be that you have just terrible consistency and all kinds of problems. To give you an example, there was a study done some years ago, and I won't go into the details of it, but just basically that healthcare, especially in America in general, has sort of an average of about 3.4 Sigma level. That's not very good, because that means that we make a lot of errors. And if you've been a nurse for a while, you know that we have falls, we have medication errors, we have any number of things that happen on virtually any given day, and that are errors, things that shouldn't happen to you, to the patients, to the system, whatever it may be. Missing medications, things that just don't go the way they should go. So the whole idea of Six Sigma is, how do we employ some of the strategies and tools in Six Sigma to reduce variation, to improve quality or improve safety. Those are sort of the main keys. We're typically trying to improve the quality of care we deliver, or the safety of care for patients, for families, visitors, whoever it may be. So those are sort of the keys to just keeping in your mind, everything we're trying to do is to reduce errors, to improve quality. When you improve patient satisfaction, you're improving the quality of the experience for the patients or the families. Obviously, when you reduce infection rates or falls, you're improving safety for patients. So just keep those sort of things in mind. Improving quality, improving safety. Sometimes they go hand in hand. Sometimes it's more one than another. But that's sort of the goal. And this QI roadmap that you'll see and we'll talk about, the key is using the letters D, M, A, I, and C. And you'll be, hearing that all over and over all semester. And so D stands for define. The first step in any quality improvement process, regardless whether it's using DMAIC or Improve or PDSA or any of the other models, the first thing you have to do is to define the problem that you're going to work on. Clearly understanding what's the clinical issue, what is the problem, and how do we know that it's a problem? What does the data say? So it's not just sort of improving something that you think ought to go better, but actually there's really no problem. One of the reasons that that's really important is that there's so much that goes on in any healthcare organization, any hospital on any given day, that there isn't time to focus on things that really aren't a problem. So for you to propose something that nobody, say your manager, educators, physicians, providers, that nobody else thinks is a problem, that's probably not the best way to go about developing a project proposal. You want to work on something that there's some consensus that this is a problem, and that there's some data that shows that it is a problem. So you define, there's a number of things that we'll go into define, and we'll go into that in more detail so that you understand it, but that's the first step before you do anything else, is to really define what are the measures we're going to use, who's the team we're going to employ to work on this, what's the background, what's the data say. We need data to show that it's a problem, then we need evidence from the literature to see what have other people done, what's the standard of care that has worked best. There are clinical practice guidelines, evidence-based guidelines for almost anything these days, and if there's not an evidence-based guideline or a clinical practice guideline, there is typically a lot of solid evidence in research studies to show the best ways to overcome virtually any problem. So that's all in the define. step, and of course that crosses over into the measure. So DM is measure, and having basic statistical measurements or basic data to measure, that's the most important thing. Is we want to work on something that you can measure, that's not just something that's theoretical, but it's something that you can actually put numbers to. So measure is very important. And then A is for analyze. So we want to be able to analyze the data, analyze the measures, and we analyze the problem by doing things like what you'll learn about, a fishbone diagram to see what we call root cause analysis, something called asking why 5 times, call it the 5 whys. So you'll learn about these tools, and that's what's going to be most important, is for you to decide which tool will work best. And then something like a process map, where you're able to actually diagram the process. So because sometimes it's in the diagram of the process, how the process is currently working, that may be where you find that the problem is really occurring, and you need to figure out how to adjust that process map. So those are just some of the tools that we'll talk about. The I stands for improve, so that's, or implement. So that's where you come up with, and once we've defined the problem, we've measured and figured out what the measurements are and what they're going to be for also post-intervention data. We've analyzed the problem and figured out what we really think the root cause of the problem is. That's where you want to act on. You want to get the most bang for your buck in implementing your improvement intervention. So that's why you have to do those first steps rather than just jumping to something that you're not sure if it's evidence-based or if it's going to work or not. So you come up with an improve or plan to implement an improvement intervention. And then C is control, and that's the final step, where hopefully you're able to sustain whatever it is that you improved. Hopefully you improved something in your intervention. Even in just doing a proposal, hopefully you not only have a proposal for how to implement an intervention, but then also a plan for, if this works and we see that the post-intervention data is very good, how do we sustain this and make this the new standard of care, the new standard practice for this issue. So I want to keep this short as possible right now. This is an introductory video that is really geared toward just helping you understand what it is you're going to be doing this semester in this course. So I look forward to seeing you in the next videos, and I look forward to hearing from all of you, and certainly working with my particular group this summer. Thanks for listening.